Welcome back. It's 12:23. Now it's time to answer some common medical questions. And joining us is News Channel 5's medical specialist, Dr. David Soria. He's the Chief of Emergency Medicine at Wellington Regional Medical Center. Thank you so much for coming in.
Good to see you, Keely.
Well, we have a couple of summertime questions, and this one's a biggie. People always want to know this. If you go swimming right after you eat, is it true you're likely to get cramps?
You know, it's been one of those wives' or mother's tales that have been passed from generation to generation. No matter what I say, it's probably still going to be passed. But the reality is, I mean, this theory came from the fact that when you eat, the cramping will occur in your muscles because you're diverting circulation to your gut instead of your muscles. And although that is true, there is some of that does go on. There's never, ever been a documented case of a drowning from somebody who has had a full stomach. So it's really been something overblown through the years. To the point where even the most conservative recommendations from either the American Academy of Pediatrics or the Red Cross, they do not give any recommendations as far as time to wait after you eat. So that being said, as a parent or for yourself, use your judgment. See how you feel. If you get out there and you feel a little bloated or crampy, stop, come back outside, wait a little bit.
It seems like it's the equivalent of going to work out right after you eat.
But you know what? Some of the recommendations by trainers is to eat before you work out,
Right.
so you have that energy. That's right. So the reality is swimming is a workout, same type of thing. Your body utilizes the energy. So no real recommendation to wait.
Okay, well, we've got another one for you. How do you know if you have a summertime cold or if it's just allergies?
Yeah, you know, this time of year you see a lot of both. And one thing's for sure, the thing that's most common about the two is that they make you feel miserable. But a virus is what causes a cold, and an allergen is what causes an allergy. Both are caused by the body's immune system a little bit differently, but some of the main differences are as follows. A cold lasts typically about 3 days to a week. An allergy can last weeks to months. That's probably the main difference. Now, as far as symptoms, you will have muscle aches with a cold. You will never have that with an allergy. You will have a fever with a cold. Never will you have that with an allergy. And typically you'll have itchy eyes or sneezing. With an allergy, with a cold, you almost never have that. So those are pretty safe as far as how or to discern or differentiate the two. And then your doctor will know how to treat one versus the other.
Okay, I say it every time you come, and I really mean it from the bottom of my heart. I feel so much smarter after you come in.
I'm glad I can help.
I do. Well, thank you so much, Dr. Soria. And if you have a question for Dr. Soria, you can send it in by going to our website, WPTV.com, and clicking on the help link. And then scroll down on the right-hand side, and you'll see a form to write your question. And thanks again, Dr. Soria, for coming in. We'll see you next week.